Hello everyone. I'm honored to be here to present regeneration of olfactory neuroepithelium and the treatment of anosmia with intranasal chitosan. Olfactory dysfunction significantly influence patients' quality of life, including feeling of flavors, appetite, and even the ability to sense the around environmental hazards. It is a common symptom in patients with COVID-19. More than 80% of COVID-19 patients have hyposmia or anosmia, and more than 40% patients have sequela of loss of smell after recovery. Clinically, steroid is still the therapeutic option for sensory neuroanosmia, but its side effect limit the clinical application and the therapeutic effect is controversial. So, it is necessary to develop a new treatment modality. Unlike other cranial neurons, the human olfactory system can replace the olfactory receptor neurons continuously throughout adulthood as the result of normal turnover or injury. However, the unique ability of the human olfactory system worsens with age in response to various toxic factors, including viruses, smoking, inflammation, medication, and environmental factors. So, the new therapeutic strategy is to develop new agents to facilitate the regeneration of damaged olfactory neuroepithelium. Glycosaminoglycans are abundant in the native neuroepithelium and given a role in cell differentiation and axon guidance. Chitosan, resembling glycosaminoglycans, has neuroprotection, which supports neuron and schwann cell growth and has good mucous adhesion. Our study has demonstrated for the first time that chitosan is a promising agent for promoting differentiation of olfactory receptor neurons in vitro, including neurons differentiation, neurite outgrowth, and signal transduction apparatus expression. Compared with the adherent culture, the sphere formation in vitro culture has numerous multipotent progenitors to facilitate incorporation into host epithelium, which is a requirement for eventual translational use. The mechanism of chitosan-mediated differentiation of olfactory receptor neurons is through increasing IGF binding protein 2 to sequestrate the IGF type 1 receptor signaling, which inhibits maturation of olfactory receptor neurons. Chitosan serves as a mediator in olfactory neuron homeostasis through facilitating human olfactory epithelial cells to secrete IGF binding protein 2. In addition, during the healing process of olfactory regeneration, some olfactory neuroepithelium is replaced with respiratory epithelium, leading to permanent olfactory dysfunction. So, the ideal agent to treat anosmia not only promote regeneration of olfactory neuroepithelium, but also inhibits metaplasia of respiratory epithelium. The results show that chitosan inhibits differentiation of respiratory epithelial cells through increasing TGF-beta1. Chitosan simultaneously promotes olfactory receptor neurons maturation and inhibit respiratory metaplasia during the regeneration process. Further in vivo studies show that intranasal chitosan regenerates olfactory neuroepithelium in the anosmic rates. First, the olfactory neuroepithelium is damaged with 3-methyl-indole. Then, we find the food finding duration in Tmax in chitosan-treated groups significantly decreased compared with untreated groups. Chitosan mediates cell fate in reconstituting olfactory neuroepithelium, thus not only encourage olfactory receptor neuron maturation, but also suppress apoptosis. Another benefit of using chitosan to treat anosmia is its excellent mucoadhesive property. Mucus is present in different forms, which include a gel layer, solution, and a suspension. Mucus adheres to mucosa surface, which protects epithelial cells from infection and dehydration. Chitosan can interact with mucin and adhere to nasal mucosa due to its spatial molecular properties. So, chitosan can promote the efficacy of treatment, and it is appropriate for topical administration in nasal system. In summary, intranasal chitosan is a promising agent to treat sensory neuroolfactory dysfunction. We have published 6 papers in SCI Journal and have patents in Taiwan, Japan, and the United States. Thank you for your attention.